Okay. Completed my hand hygiene while walking into the room. Hi, my name is Peter. I'm your nurse practitioner student. Can I get your name, please?
Desiree.
And I'm going to perform a cranial nerve exam on you. Is that okay?
Yes.
And will you let me know if there's any tenderness or pain throughout the exam?
Yes.
Okay. So I will go through, I will explain all, I will state, name, and explain what all 12 cranial nerves do and perform small exams on them. So the first one is your olfactory nerve. This is responsible for smelling. It is a sensory nerve, and we are going to do a smell test. So can I first check for patency of your nostrils? Can you cover your left nostril for me? Take a smell. All right, cover your right nostril. Take a sniff. All right, both nostrils are patent, so I will go ahead and do a smell test. Can I have you close your eyes for me, please? All right, cap one of your nostrils, your right nostril. Now tell me what you smell.
Coffee.
Okay. Close your left nostril for me. All right. Tell me what you smell.
Lemons.
All right, patient was able to correctly identify both smells. Her olfactory nerve is intact. All right. Cranial nerve number 2 is the optic nerve. This is responsible for vision. So it is a sensory nerve. I'm going to, first by checking her vision, you are wearing corrective lenses right now. So I'm going to have you look at the Snellen chart, which is roughly 20 feet away, that I post up on the wall. Can you tell me the smallest line that you were correctly able to read?
DEFPOTEC.
Okay. So patient was able to read the 20/20 line of the Snellen chart with corrective lenses on. So now I'm going to check for her 4 quadrants of sight. I'm going to have you look at my nose. All right. So close your left eye, please, for me.
2, 2, 2, 1.
Okay. Now close the other eye.
2, 1, 1, 2.
All right. Thank you. Patient was easily able to identify all 4 quadrants, so that is intact. Can I have you take your glasses off for me, please? I'm going to do a fundoscopic exam. So let's start here. Okay. So I am going to look at your eyes, and I'm going to come a little bit closer, so we might get a little close.
Okay.
So your right eye. So right. There we go. All right, so you can see the red reflex is intact. All right. I know, I'm sorry. I'm going to do a little right, left side now. Red reflex was also intact. Okay. So red reflex was intact in both eyes. I was able to see that the optic disc was clear. It was creamy pink. There was no swelling noted, no cupping noted. It was sharp. The optic disc was, the physiological cup was less than half, and like I said, no swelling or cupping noted. The arteries and veins were roughly 2 to 1. The arteries were smaller than the veins. The veins were slightly purple. There was no tortuosity of the veins noted. As well as the retina. The retina was like a deep orange, and the macula was slightly smaller than that as well. So that was a good fundoscopic exam. Nothing that I saw. There was no hemorrhages, no exudates in the vessels as well. Next, I'm going to do cranial nerves 3, 4, and 6. Cranial nerve, these are all motor neurons. Cranial nerve 3 is the ocular motor, responsible for pupillary reflex and elevation of the eyelid. It accomplishes this by the medial rectus, the superior and inferior rectus, and the inferior oblique muscles of the eye. The cranial nerve number 4 is trochlear. This is also responsible for medial inferior eye movement, and this is accomplished by the superior oblique. The cranial nerve number 6 is abducens. This is accomplished by, it does lateral eye movement via the lateral rectus muscles. So now I'm going to do a series of tests. So to test these. All right, first I'm going to check for your pupillary response and consensus. My glasses on. All right, so I did see equal reactivity of the eyes, of the pupils, as well as good consensus. Now I'm going to check for accommodation. So kind of look behind me. Now look at my finger. Eyes moved together, there was good accommodation. So we can say she has perla, which is pupillary response is equal, round, and reactive. And her pupils are roughly 3 millimeters. And now I'm going to check for your 6 cardinal gazes. So I'm going to check for any jittery movements of your eye. So please just follow my finger. Patient was able to follow all 6 cardinal gazes. There was no jittery motion, no nystagmus, nothing that I could see. Next, I'm going to check for your corneal light reflex. So just look kind of past me. All right. So the corneal light reflex was bilaterally positive. And now I'm going to check for any deviation. So please look at the wall behind me. All right. Now focus one of the letters on the chart.
Oh, can I put my glasses back on?
You put your glasses back on. Letters on chart. Cover your left eye. Okay. Now undo it. Cover your right eye. Okay. So all good. So there was no deviation noted in either of the eyes. They stayed straight. So that was negative. So all cranial nerves 3, 4, and 6 are intact. Cranial nerve 5 is the trigeminal nerve. This is a sensory and motor neuron responsible for innervating the forehead, the cheek, and the jaw, and also by motor by moving the jaw for mastication via the masseter muscles. So I'm going to start by having you move your jaw side to side like this. Okay, good. There was no limitation of movement side to side. Now I'm going to palpate your temporal region, and then I'm going to want you to grit your teeth, okay? All right, there was good response there of the masseter muscles. So mastication should not be held. So that is an intact cranial nerve number 5. Cranial nerve number 7 is the facial nerve. So this is responsible for sensory and motor. It is responsible for tasting the anterior 2/3 of the tongue, as well as part of the throat, and is also responsible for movement of the face. So we're going to check facial movements. Can I have you smile? Can I have you show your teeth? Now can I have you raise your eyebrows, puff your cheeks? Cranial nerve number 7 is intact, the facial nerve. Cranial nerve number 8 is your auditory nerve. This is a sensory nerve that is responsible for hearing. So we are going to perform a whisper test, a Weber's test, and a Renee's test. So first we're going to do the whisper test.
Okay.
All right.
Baby Chloe beautiful.
Correct.
Beautiful baby girl.
She was able to correctly identify the whispering. So I'm going to perform a Weber's test. This is to check to see any sensorineural hearing loss. So I want you to tell me if it is stronger in one ear or the other, okay?
Okay. It's even.
Okay, so there was no lateralization of the being able to hear on either side of the ear. The next test is going to be a Renee's test. I'm going to ring it. I'm going to place it on your mouth state process. When you stop hearing it, I'm going to place it over your ear. I want you to tell me when you stop hearing it again.
Okay.
All right?
Stopped. Stopped.
Okay, so that was a little longer than 1 to 2. So that was a good test. in both. Sorry, my battery's getting low. So that was a good test in the left ear, or her right ear. So I'm going to redo this on the left ear as well.
Stopped. Stopped.
Okay. So that was also 1 to 2. So that was a good Renee's test. So there was no deviations, no bad sensorineural or conductive hearing loss. So next we are going to do cranial nerves 8 or 9 and 10, which is the glossopharyngeal and the vagus nerve. So glossopharyngeal is these are mixed neurons tested together. The glossopharyngeal is for the posterior 1/3 of the tongue, as well as phonation and swallowing, and the vagus nerve is responsible for the gag reflex. So, and they work together. So we're not going to test for taste, but we are going to check for, first, can I have you, got my flat light, open your mouth. All right, now stick out your tongue, say ah. Okay. All right, so the uvula raised and lowered in midline. Can I have you swallow? All right, and now check your gag reflex. All right, so gag reflex is intact. So cranial nerves 9 and 10 are intact. Now we're going to do cranial nerve number 11, the spinal accessory nerve. This is a motor neuron, and it is responsible for innervating the trapezius as well as the sternocleidomastoid muscles. So I'm going to press my hands against your shoulders. I'm going to want you to raise them, okay?
Okay.
Raise up your shoulders. Perfect. Now I'm going to place my hand on your cheek. I want you to press into my hand, okay? While turning your head.
Okay.
Okay? All right. Motor response was strong and bilaterally equal. So the spinal nerve 11 is intact. Spinal nerve 12, or cranial nerve, I'm sorry. Cranial nerve 12 is hypoglossal. This is responsible for movement of the tongue. So I'm going to have you stick out your tongue straight out. Open your mouth and stick out your tongue. Okay. Now push your tongue into your cheek left. All right. Now go the other way. All right. Perfect. So there was equal bilateral strength as well as no deviation of midline from the tongue sticking out. So her hypoglossal cranial nerve 12 is intact, which was a motor nerve. So thank you very much. Thank you.